Welcome. I'm Karen Jones, President and CEO of the National Caucus and Center on Black Aging, NCBA, headquartered in Washington, D.C. Like you, I've attended more meetings and webinars about COVID-19 education than I care to count. We're all on information overload, but we're offering something different, namely a free toolkit to help you reach those who are still not vaccinated for logistical reasons or still just have some nagging concerns and doubts about the vaccine. Listen, I've been there. This time last year, I was totally against getting the vaccine. Fear, history, uncertainty, all feelings that contributed to my hesitancy. But then I saw the numbers that grew of hospitalizations and deaths in communities of color. I decided I had to educate myself. I researched what the vaccine was, who was participating in the clinical trials, how the approval process was conducted, and who and what trusted voices were sharing information and their experiences. In addition, as a leader of my organization, I had the responsibility to learn as much as I could to be able to share with our older adults and our network the best information I could so that they could make the best decisions for their health. I got educated and I got vaccinated against COVID-19. Many of you know the Reverend Dr. Frederick Haynes, pastor of Friendship West Baptist Church in Dallas, Texas. Like many congregations, Friendship West was very active and assertive about demanding and facilitating testing and then vaccinations for the Dallas African American community. Here are some of his thoughts and suggestions.
If you want us to really get vaccinated, and that's the question, do you want Black folk to get vaccinated? And if the answer is yes, then take advantage of trusted institutions. And when you take advantage of trusted institutions, then we want you also to recognize there is hesitation in the Black community because of the ugly history. That means you're going to have to also be responsible for educating people, but don't use white folk to educate us. We don't trust you. We need folk who look like us in order to get the message to us. And so we basically broke down barriers to vaccinations. Our church became a site, as well as a couple of other churches on the south side of town. And again, we became vehicles for education. And we also gave the people an opportunity to ask questions, and not only to ask questions, but to get their questions honestly and forthrightly answered. And so those have been, the three ways: education, being an example, and then fighting like hell to make sure the barriers come down. Because the bottom line is, you got a lot of, I mean, we were, when this thing first hit, what we were least tested, but dying most. And so that for me, that was real problematic, and it was something we had to fight through. And not only do you have those who are not internet savvy, but sadly on our side of town you have what, internet apartheid, a lack of access to Wi-Fi. And so what we did was take advantage of the church and made the church a Wi-Fi hotspot, but also a Wi-Fi educational spot, so that we could, you could bring your grandmother. You could bring your mother, your aunt, your uncle, your grandfather. You can bring them to the church and utilize our computer lab in order to register them. And so that was a part of an advantage that we have because we already had a working computer lab, and that computer lab helped us to connect those who were disconnected. We have organized, both carpools and our church vans to transport persons from, their home to the vaccination site. And but again, we were real late with this, and I really want to encourage everyone listening, make that a priority. Don't take for granted that everyone has access to transportation. Do not take that for granted because that's not the case. And again, we were late. I'm glad we finally picked up on it because we went a couple of weeks and finally the phone calls were piling up and they were saying, hey, we'd like to get there, but we can't afford Uber. We'd like to get there, but the bus route to get to the space uh, is not direct and it takes too long and it's just out and out inconvenient. And so that's when it just finally hit us like, duh, we need to provide transportation. And so we organized a series of carpools we made available. You can call the church and get, transported via our church van at these times. Again, practicing social distancing. Only so many people are allowed in the van. Like we would only allow 3 persons in the van. That means 1 person on each row. So we were very insistent on that.
Dr. Haynes's suggestions and others are included in the toolkit, which also features an infographic that can be distributed to your membership or your clientele, appointment cards that can help seniors keep up with their dates and times for their shots and transportation arrangements, and this brief informative video.
It started as a news story about something happening in China, thousands of miles away. But soon enough, it was here, and when the coronavirus got its grip on the United States, African Americans suffered and died more than any other demographic group. Many people were surprised by that, or pretended to be, but we knew why. The long, shameful history of inadequate, inaccessible, unaffordable, and sometimes negligent, even deceptive health care, food deserts, and environmental exposures allowed other conditions to weaken us: hypertension and heart disease, diabetes, respiratory illnesses, obesity. And a weakened system was a magnet for this wicked virus. The mysterious invisible organism in our midst spread like wildfire, and not knowing what else to do at the time, the world locked down. No more going to work, or to church, or to the doctor's office, or even seeing friends and family. Then came the mask to keep us from spreading germs and protect us from taking them in, and hundreds of thousands of people still died. Scientists in the medical community responded dramatically with unprecedented speed, first developing tests to detect the virus, and then, miraculously, vaccines that have proven to be safe and effective. Yet some people still aren't sure, and that's understandable.
Given the history in our community, when it comes to science and scientists, we all know about Henrietta Lacks. We all know about the Tuskegee experiment. We all know about the fact that even in the 21st century, there are doctors, sadly, who don't believe that the Black pain threshold is the same as other folk. And so with that being the case, we still continue to suffer from what I call medical apartheid and racism in the healthcare profession.
But things have changed. Medical ethics, training, accountability, and personnel have evolved. Moreover, many of the professionals on the front line of science and medicine are themselves African American. Dr. Kismiga Corbett, the brilliant young immunologist who led the National Institutes of Health team in developing one of the vaccines, a woman of science and of faith.
Dr. Kismekia Corbett, or Kizzy Corbett. Kizzy is an African-American scientist who is right at the forefront of the development of the vaccine. So the first thing you might want to say to my African-American brothers and sisters is that the vaccine that you're going to be taking was developed by an African-American woman. And that is just a fact. I mean, that is a fact. And I think that's some of the things that people don't fully appreciate.
You know, outside looking in, I understand that when you've seen medical advances take 10, 15 years to be developed, that for this new virus popping up essentially out of nowhere, and these scientists coming together all over the world and making these vaccines in collaborations with companies that sometimes can't be trustworthy over the course of 8-9 months, etc. It looks like, how are they really doing this? Like, are they letting things slip through the cracks? Who's vetting this? Who's judging the data, etc. And what I can say is that there was a large effort from our team personally and many teams around the world to understand how to make a vaccine for coronaviruses even before this pandemic. Reminding everyone that this is not our first time to the rodeo. Sure, the bull might be, dancing around a little bit harsher than before, but we've been to this rodeo before because coronaviruses like MERS and SARS were already circulating previously in humans and caused little epidemics. And so we knew that this was possible. And so because we knew that it was possible, what my job is actually at the Vaccine Research Center is to help a team of scientists prepare in the case of a pandemic. And so we studied this virus, this viral family. We understood how to make a vaccine to it. We had these collaborations with these pharmaceutical companies established to the point that there was this trustworthy connection. And so we could really enable really fast manufacturing, et cetera. And then on the other side of it is this intricate network of organization between companies, the government, community organizations, et cetera, et cetera, et cetera, that are working together in a way that we have never seen before to help to fuel this forward. Because as I've said, really a vaccine is essentially at this point our only way out of the pandemic.
Still, you may have heard all kinds of worrisome things about the vaccine. Here are some of the things people are saying. The vaccine will change your DNA. The shot implants a surveillance chip in your body that allows the government to track you. The vaccine causes infertility in men. The vaccine causes infertility and miscarriage in women. Anyone who gets the shot will no longer be eligible for food stamps. The vaccinations we've seen on TV are all fake. The FDA did not approve the vaccines. A nurse in Tennessee died after taking a shot. Have you heard these? All of them are false. And just because you saw it on the internet or on social media or heard it from your best friend doesn't make it true. The vaccine has no effect on your DNA any more than the flu shot does. There's no tracking plan with chips. The vaccine does not affect fertility in any way. The shots are free and have nothing to do with food stamps. The televised vaccinations are real. All vaccines administered in the U.S. received FDA scrutiny and approval. That nurse who passed out after taking her shot, she has a pre-existing condition that makes her faint often. She's alive and well in Tennessee. Most of all, the vaccine cannot give you COVID because the shot doesn't contain any of the virus. Instead, it has a protein with a signature your immune system recognizes, signaling your body to do what comes naturally and what it does best: start making antibodies to fight it. Here is what the COVID vaccine will do. 1. Keep you from getting sick enough to be hospitalized if you do get COVID, or in all probability, keep you from getting it at all. 2. Protect other people, including and especially those you love. And 3. Allow your life to return to normal. When you get the vaccine, medical personnel will monitor you for several minutes to make sure there are no ill effects. Most people will go about their way in 10 to 15 minutes. Millions of Americans have now safely received the vaccine. Some report soreness at the injection site for a day or two. Some develop a slight fever, have a headache, or feel fatigued for a day or two afterward. But this just means your body is kicking into action and making those antibodies that protect you. The vast majority of people feel little or nothing at all.
But reactogenicity is not harmful. In fact, what it means is that your body is doing exactly what you want it to do. It's causing a localized immune response so that you can build up this type of immunity that you need to protect you against COVID-19 disease.
We hope this has helped answer your questions and relieve your doubts and concerns. Please get the vaccine. It can save and restore your life.
Again, this video is in the toolkit, and we encourage you to share it far and wide. You may want to have a showing or more than one for your membership. You may know another church, community center, sorority, fraternity, or social service organization that can show it or email it to their membership list. In other words, there are no limits on distribution. That toolkit is attached to this email, but if you're uncomfortable with downloads, you can visit the NCBA website and download the free toolkit there. Please go to this address to download: www.ncba-aging.org. It's free, and we want you to share this information everywhere and to anyone. We appreciate your attention and hope that this will just be one more resource to continuing our quest to combat the myths, relieve the doubts, and remove obstacles to getting our community, especially our vulnerable seniors, fully and safely vaccinated. Thank you.